Hi everyone, my name's Buddle, Associate Provost at beautiful McGill University here on the downtown campus, and the sun is shining on this cold January day. I thought I'd take a few minutes today and talk to you about some answers to very common questions that we're getting with respect to the ongoing pandemic and the current return to campus. So let's take a couple questions. The first question we're getting is about rapid tests. As many of you know, we had an asymptomatic rapid testing locations on the downtown McGill campus in the fall, and things have changed since then. Most importantly, as many of you are aware, rapid tests are not as available as we'd like them to be, and they're to be used for symptomatic individuals. And we don't want symptomatic individuals coming to our campus, so we're no longer offering the asymptomatic testing clinic on campus. We are, however, using that approach of the symptomatic testing clinic in residence halls. We have 3 testing locations, so if you're a student living in residence halls who develop symptoms with respect to COVID, you can go to these testing centers and get tested if you're symptomatic. The other question we're getting about rapid tests is, why are we not just distributing rapid tests to our entire community? There are a couple reasons for this. First of all, rapid tests are scarce. They're more scarce than we would like. The second main reason is the way that our testing clinic worked is that the tests themselves were in bulk and can't be easily repackaged for individual tests. And in fact, our experts tell us that'll reduce their reliability, which is not going to help at all. So we have a combination of the use of the clinic, it's for symptomatic individuals, and we can't just redistribute the tests to anyone in our community who wants them. We don't have that kind of volume as well. The other question about rapid tests then is what to do if you're symptomatic and don't have access to rapid tests. Well, first of all, you're not going to come to campus. If you're on campus, you're not going to stay on campus. The other thing to note is that you don't require a rapid test, a positive from a rapid test, in order to access the accommodations that are in place. So whether you're a student or a staff, you can go on Minerva through your personal menu and fill out the form requesting accommodations if you do test positive or if you're symptomatic. The next question is actually going to be done in the Bronfman building, and this has to do with the mask recycling program that we now have in place at the university. Thanks, everyone. I'm entering the Bronfman building. I'm making sure my hands are disinfected. I can take a new mask if I don't already have one on, but this is a new mask. And look, here's your mask recycling bin where you put your old procedural masks in. Let's do a Q&A about what can go in a mask recycling bin.
Can you throw banana peels in the mask recycling bin?
Banana peels do not go in the mask recycling bin.
Apple cores?
Apple cores do not go in the mask recycling bin.
Paper?
Paper does not go in the mask recycling bin.
Empty hand sanitizer bottles?
Empty hand sanitizer bottles do not go in the mask recycling bin.
Candy wrappers?
Candy wrappers do not. Candy wrappers go in the garbage.
Wine corks?
Wine corks definitely do not. You use those to throw at your partner.
Disposable gloves?
Disposable gloves do not go in a mask recycling bin.
A sock with a hole in it?
A sock with a hole in it needs to be darned, not put in a mask recycling bin.
Procedural masks?
Procedural masks do go in the mask recycling bin.